Newborn babies have certain common issues which are fairly non-dangerous, but they worry the parents a lot, especially the first-time parents. Amongst these common issues, the most common ones are newborn jaundice. So this newborn jaundice is because of the increasing bilirubin levels of these newborns, and these newborn babies, they have this increasing bilirubin levels because there is a high turnover or cell breakage of the blood cells, and the load of clearing this is on the small liver of these newborns, which cannot handle the turnover, which will lead to the increased bilirubin levels that will be seen as a newborn jaundice. Most of the times this jaundice is very common and non-threatening or non-dangerous, but when the level increases in certain cases, like in where the babies, they don't get adequate feeding, or some babies, those who have mother to baby blood group mismatch, or some babies in which they have a genetic predisposition for the increasing jaundice, those are the cases where this jaundice, rising levels of jaundice, is dangerous. So it is very common, but at the same time we have to keep a vigilant eye on this jaundice, so that if the bilirubin levels go beyond a certain level, it has to be addressed by your pediatrician or neonatologist to see that it is brought back to the normal levels, and also to evaluate the reason for that increasing jaundice levels. Most of the times it is not dangerous, but yes, it has to be vigilantly observed that it is not going to a certain level that has some effects on the baby. The second most common thing is feeding difficulties. Most of the mothers, especially the first time mothers, they face a lot of difficulties in feeding the baby because of unawareness of the breastfeeding, the posture with which they have to hold the baby, or the latchability of the baby, and sometimes the mothers may have nipple issues, so which lead to a lot of feeding difficulties, that leads to a lot of mental stress, and at the same time, when the baby is not fed properly, baby can land up with dehydration. So I recommend every mother who is facing that feeding issues to take a lactational consultation, so that they'll feel more confident in feeding the baby, and the milk output of the mother will be very much improved, and that helps the baby's overall growth and overall development. And other common issues include something like a diaper rash, which we commonly see in the babies, where the diaper is used for prolonged hours. So what I would say is it is not like not to use diaper. You may use the diaper, but see that the contact of the diaper, that is in the surface of the diaper that is in contact with the skin of the baby, should be very soft, non-allergic, and at the same time it has to be frequently seen or checked whether the diaper is soiled with urine or stools, and whenever the soiling of the diaper happens, it has to be removed, and a proper new diaper has to be worn. So it is not the diaper that is more important. What is more important is the soiling of the diaper, that should not be in contact with the baby's skin surface for longer durations. So it has to be removed as early as possible, and the skin surface and the skin folds have to be maintained dry and clean as much as possible, and avoiding the prolonged contact of these soiled diapers with the baby's skin surface. So these are a few common issues that parents of the newborn babies that come across. So taking appropriate care and taking the pediatrician advice on a timely manner will help in avoiding potential complications in these babies. Thank you so much.